Deciphering the differences. Type 1 versus Type 2 diabetes. 1. Introduction. Two phases of diabetes. Diabetes is a chronic metabolic disorder that affects how the body uses or produces insulin, a hormone crucial for regulating blood sugar levels. While both Type 1 and Type 2 diabetes share the name, they are distinct conditions with different causes, onset mechanisms, and management approaches. 2. Type 1 diabetes. Autoimmune origin. Type 1 diabetes is an autoimmune condition where the immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas. This results in little to no insulin production. Onset. Typically diagnosed in childhood or adolescence, but it can occur at any age. The onset is often abrupt, and symptoms can develop rapidly. Insulin dependency. Individuals with Type 1 diabetes are entirely dependent on insulin injections for survival. Continuous monitoring of blood sugar levels and precise insulin dosing are essential. 3. Type 2 diabetes. Insulin resistance. Type 2 diabetes is characterized by insulin resistance, where the body's cells don't respond effectively to insulin. Initially, the pancreas compensates by producing more insulin, but over time, it may not produce enough. Onset. It is more commonly diagnosed in adulthood, but the rising prevalence of obesity in children has led to an increase in Type 2 diabetes among younger populations. Management approaches. Treatment may involve lifestyle modifications, oral medications, injectable medications, or insulin therapy, depending on the severity of the condition. 4. Risk factors. Type 1 diabetes. The exact cause of Type 1 diabetes is unknown, but genetics and environmental factors, such as viral infections, may contribute. It is not linked to lifestyle or diet. Type 2 diabetes. Risk factors include obesity, sedentary lifestyle, genetics, age, and certain ethnicities. Lifestyle choices, such as poor diet and lack of physical activity, play a significant role in the development of Type 2 diabetes. 5. Symptoms. Common symptoms. Both types share symptoms such as excessive thirst, frequent urination, unexplained weight loss, and fatigue. However, these symptoms may be more abrupt and severe in Type 1 diabetes. 6. Diagnosis. Blood sugar levels. Diagnosis for both types involves blood tests to measure fasting blood sugar levels and, in some cases, oral glucose tolerance tests. Autoantibody testing. Type 1 diabetes is often confirmed through autoantibody testing, which detects the presence of antibodies attacking beta cells. 7. Treatment approaches. Type 1 diabetes. Insulin therapy is the mainstay of treatment for Type 1 diabetes. Various insulin delivery methods, including injections and insulin pumps, are used to mimic the body's natural insulin production. Type 2 diabetes. Treatment may begin with lifestyle changes, including diet and exercise. Oral medications, injectable medications, and insulin therapy may be prescribed based on the progression of the condition. 8. Prevention. Type 1 diabetes. Currently, there is no known way to prevent Type 1 diabetes. Type 2 diabetes. Lifestyle modifications, including a healthy diet, regular exercise, and weight management, can significantly reduce the risk of developing Type 2 diabetes. 9. Conclusion. Distinct entities. While both Type 1 and Type 2 diabetes share the common element of disrupted blood sugar regulation, their origins, onset patterns, and management strategies differ significantly. Understanding these differences is crucial for effective diagnosis, treatment, and prevention efforts tailored to each type of diabetes.